Chronic kidney disease, the disease that kills the poor and spare the rich. Charles Caleb Colson once said, "The poorest man will not part with health for money, but the richest will gladly part with all their money for health." Hello, welcome to a new episode of Health Series, Your Health, Your Choice. My name is Dr. Joe, medical doctor and a health promoter. Today we'll be talking about this disease that kills the poor and spares the rich. In the part 1 of this video, we'll be looking at what chronic kidney disease is all about. Why should people know about it? The causes, the risk factors, and the symptoms. Before we continue, I just want you to know that the purpose of this video is not to give you medical advice, no. Rather, it is to give you information. There are 3 steps that lead to making changes. Number 1, you need knowledge, and knowledge ensures information. Then you need comprehension. You need to be able to understand what you have been taught in a way that is very easy and simple to understand. And the third thing is application. How to apply the knowledge you have gotten. So my hope here today is to present you information, or just present it in a new light, in a way that is relatable to you. And then that information, if you are able to understand it, then you can make choices that hopefully will make you to be more healthy and live longer and a happy life. So let's get started. Kidney failure means one or both of your kidneys no longer function well on their own. So chronic kidney disease is a condition in which the kidneys are damaged and can no longer filter blood as well as they should. Because of this, excess fluid and waste from blood remain in the body and may cause other health problems such as heart disease and stroke. God gifted humans with a pair of powerful filters to clean the human body of its waste. Before we continue, let's take a look at how kidneys work in the body. Your kidneys are bean-shaped organs about the size of your fist. They sit under the ribcage towards your back. Most people, they have 2 working kidneys, but you can actually live with only 1 kidney as long as it's working correctly. Most of us are gifted with 2 kidneys. Rarely, some may only have 1. One of the important jobs of the kidneys is to clean the body. As blood moves through the body, it picks up extra fluids, chemicals, and wastes. The kidneys then separate these materials from the blood. It is carried out of the body in urine. If the kidneys are unable to do this, waste products build up in the body, and if the condition is untreated, serious health problems result with eventual loss of life. Who does kidney failure affect? Kidney failure can affect anyone. However, you may be at higher risk of developing it if you have diabetes, if you have high blood pressure, that's hypertension, if you have a heart disease, if you have a family history of kidney disease, if you have abnormal kidney structures, if you are black, if you are Hispanic, if you are Native American, if you have a long history of taking pain relievers, including over-the-counter product drugs such as non-steroidal anti-inflammatory drugs, NSAIDs, ibuprofen, diclofenac, etc., then you are at risk of developing kidney disease. How common is kidney failure? An estimated 1 million people worldwide die from untreated kidney failure each year, which leads to this question: what are the causes of chronic kidney disease? Chronic kidney disease is usually caused by other conditions that put a strain on the kidneys. Often, it is a result of a combination of different problems. Chronic kidney disease can be caused by number 1, high blood pressure, because over time this can put a strain on the small blood vessel in the kidney and stop the kidneys from working properly. Number 2, diabetes. Too much glucose in your blood can damage the tiny filters in the kidneys. Number 3, high cholesterol. This can cause a buildup of fatty deposit in your blood vessels supplying your kidneys, which can make it harder for them to work properly. Number 4, kidney infection. Number 5, glomerulonephritis, that's kidney inflammation. Also, polycystic kidney disease, that's inherited condition where growth cause cysts develop in your kidneys, can also cause CKD. Then blockage in the flow of urine, for example, from kidney stone that keep coming back, or an enlarged prostate, that's long-term complication. Regular use of certain medications such as lithium or NSAIDs, that's just like diclofenac, ibuprofen, etc. The use of bleaching cream because they contain mercury and lead, which is toxic for your kidneys. Now, aside bleaching cream, hypertension, as I mentioned earlier, diabetes, with other causes I've listed. One of the major leading causes of kidney failure in Africa, especially in the western part of Africa, is herbal concussion. I'm sure you're surprised. Herbal medicine are perceived as being natural and therefore safe. However, they are not free from adverse effects, which may be due to factors such as contamination, misidentification, lack of standardization, incorrect preparation, and dosage. Herbal concussion can damage the kidneys. It is a lot cheaper to prevent kidney damage because once you have it, there's no going back. You can help prevent chronic kidney disease by making healthy lifestyle changes and ensuring any underlying condition you have are well controlled. So, what are the symptoms of chronic kidney disease? Number one, fatigue or being extremely tired. There are many reasons for that. Anemia or low blood count is one of them. Number two, insomnia. Number three, itchy skin or pruritus. There are some electrolytes such as phosphorus and urea which are typically cleared by the kidney. If you have elevated phosphorus level, which happens later as the disease progresses, then it will cause you to have itchy skin. Number four, frequent urination. If you urinate more frequently than usual, especially if you get up in the middle of the night several times to use the restroom, this could be a symptom of kidney failure. There are other conditions that can actually cause frequent urination too, such as diabetes or enlarged prostate. Then number five, bubbly or foamy urine. If you urinate in the toilet and it looks very bubbly or foamy, this could also be a symptom of kidney failure. This happens when patients have protein leaking in the urine, which is not normal. It's a sign of kidney disease. Number six, leg or ankle swelling. Patients with chronic kidney disease can get swelling in the leg and ankle, known as pillar edema, for different reasons. They can be retaining more fluid because of the kidney's failure. If you have a leg or ankle swelling, make sure to see your doctor because this could simply be a sign of kidney failure. Number seven, nausea or vomiting. Number eight, tremor or shakes. This could be a sign of kidney failure because of elevated toxins in the body that ends up poisoning the nerves in the body, causing tremor. These are just some of the symptoms out of many. Now we have come to the end of part one of this episode of chronic kidney disease. Please stay tuned as you watch out for the part two, where we will be talking about how this disease is treated, the cause implication, and I will be sharing with you too some kidney-friendly tips to stay healthy. Thank you for joining me today. Don't forget to like, to subscribe, and to share. Thank you.